the recording. And then we go to sharing the screen page, and here we are. So we continue speaking about medications. That is unit number 5 from the book. And so you remember that you were given the task to do some exercises, matching exercises with phrasal verbs, where the task was to match a phrasal verb with its meaning, and there were some mistakes there. So the mistakes in these just examples, which are given here on this slide. So you just there were a lot of students who just misused these phrasal verbs. The meaning of flare up is given here. This is suddenly appear or reappear. So this is that is the meaning which should be given next to flare up. And then come around is become conscious again, to go back, come around. And spread from person to person, go around. This is like a disease, infectious disease, like a flu, which goes around the city. Well, and there was also there was several mistakes in this task, where the task was to choose the correct preposition, which is used with the verb clear, and they make the phrasal verb. So and there are 3 options: clear out, clear in, and clear up. And so as it can be seen from this screen, clear out means to leave a space quickly. And example with this phrasal verb is he cleared out with all the money and left her with the kids. So in the context. As for clear up, the meaning of this phrasal verb is to become fine, to disappear when we speak of an illness or infection. And the example is the sky cleared up after the rain. And clear in is not actually a phrasal verb, but this preposition can be used after clear, like in the sentence, their diagnosis was clear in the first phase of the study. So it's not a phrasal verb. So what should we choose in this sentence about Elaine? Elaine rash began to clear up after she started using the cream. So that was the correct option. Okay. And so you remember that last class we started speaking, we were listening to the conversation of a doctor who was describing the benefits and side effects of aspirin to his patient, and he just used some phrases which are presented here on this slide. And I would like you to summarize what you do remember about the benefits and about the side effects of this medicine, about aspirin, and as if you are explaining them to a patient using these phrases which are given on this slide, like first I'd like to will help you a lot, as it just what will help you and why. So helps to prevent, I just have to point out. So sometimes people get, or it can make, or it can cause. And then you remember that the doctor asked the patient to repeat this information that he heard. He's heard, like, would you like to go through? And you should just think about the second part of this phrase. Well, who would like to start speaking about aspirin? Or do you need time to make notes about this? Shall I give you?
Yes.
Okay. So let us just a couple of minutes, please. Okay, so let us check what you've written. So who would like to speak? Okay.
The first one is like, first I
What's
would
your
just like you, Ma'am Bhargavi.
Bhargavi? Okay, so
So the first sentence, it could be like this. First, I would just like you to listen to me about the benefits of aspirin, so that it will help you uh, regarding your pain or something, and also you have to listen to the side effects of aspirin so that you can prevent that.
Okay, thank you. So you've just said about the benefits, yes? How to say to the patient about the benefits. Who will continue speaking about side effects?
Ma'am, I can.
Your name? Your name?
Mayuka.
Mayuka, please.
Yes, ma'am. I'll continue from the fourth point.
Okay.
I just have to point out about some side effects of aspirin. Sometimes people get stomach or gut irritations, or it can make you feel nausea, or it can also causes indigestion. Would you like to go through the side effects list or leaflet of the aspirin?
Thank you. Okay, good. And there is a diagram which shows side effects of aspirin here on this slide. So can you add anything looking at the prompts which are given here in the picture?
Muscle cramps.
So how to...
Sometimes people may get muscle cramps, and sometimes it can lead to ulcers.
Yes.
And some people might feel nausea, kind of nausea. And it can cause abdominal pain.
Not necessarily, yes. Okay.
Or it can make a person feel dizzy.
You're right. Okay, so this is the way you should just explain to the patient everything about a medicine. So to be sure that he understands all the benefits and risks of taking this medicine. Well, good. Now, in this, here we, okay, use some phrasal verbs. And now we are speaking about, we are focusing on language, on grammar. about phrasal verbs, the use of phrasal verbs. And here on this slide, you can see the examples of 5 phrasal verbs with the verb run. Depending on the preposition, on the particle which is used with this verb, the meaning of the verb changes. So, for example, if we add inter, run inter, the meaning will be to meet someone unexpectedly. And the example, I ran into my English teacher at the shop. So I met her or him unexpectedly. Then if we use through, run through, the meaning of the phrase is explain quickly. And the example is, let me run through the schedule for the show. Means let me explain something to you. And when we use on, run on, it has the meaning be powered by. So electric cars run on electricity, not gas. So are powered by electricity. Run up means spend a lot of money on credit. I ran up a debt of 10 pounds, 10,000 pounds on my credit cards. And the last is run out of, which means have none left. So we need to buy some more eggs because we have run out of them. So this is the example of a phrasal verb with the same verb. In last class, we were listening to the doctor, and so the doctor said to the patient, he used this phrase, there's a lot of information to take in at one time. Take in is the example of a phrasal verb, and here's the information about its meaning. So the verb to take in means here to understand. So, and it is so-called separable phrasal verb because you can separate the verb take and the particle in, and you can use another word between them. We can say it is difficult to take in information. The verb goes together with the particle, or we can say it is difficult to take information in. The verb and the particle are separated by the word information. It is also possible because this is separable phrasal verb. And if we move to the next slide, there is an example of inseparable phrasal verb. The verb to get up is an example of inseparable because you cannot separate the verb and the particle. So if you can take the medication soon after you get up in the morning, we can't use anything between get and up. We can't separate the verb and the particle. And there is just more detailed information about how to separate phrasal verbs. Just in order to understand this, we need to some extra information about the types of phrasal verbs. So there are different types, like here we are speaking about transitive phrasal verbs and intransitive verbs. So transitive verbs, they have a direct object. They require a direct object. And intransitive, they do not have, they have no direct object. So intransitive verb, like get up, we were speaking about. So I get up in the morning. So no object for this verb. And example of like transitive. Yeah, is coming. Transitive, the transitive phrasal verbs can be separable or inseparable, as you see in the diagram. And so separable, turn off the TV. As far as this is separable, we can say turn it off or turn the TV off is also possible. And inseparable, they can't be separated. So, well, And if we move to the next slide, there are some more examples here with the transitive phrasal verbs, so which can be separated. For example, call the appointment off, call off. Or we can also say call off the appointment. But if a phrasal verb is separable, we can separate the verb and the particle. It must be separated when its subject is a pronoun, like it, her, them. If we use a pronoun it instead of the appointment, we should say call it off. We can't say call off it. It will be incorrect. So it should be separated by a pronoun. And so inseparable transitive phrasal verbs are given here. So she is just starting to get over the flu. And if we just replace the flu with the pronoun it, so we can't use it in the middle of the phrasal verb. She is just starting to get over it. This is the correct option. And we can't say she's just starting to get the flu over. So we can't use anything in between the verb and its particle. And so inseparable transitive phrasal verbs which have no direct objects are presented here. The example, when we visited Paris, we loved eating out in the sidewalk cafes. Eat out means dine in a restaurant. So it is inseparable. And day after day, if rain showed up for class 20 minutes late, show up to arrive, he arrived. So this intransitive phrasal verb is also inseparable. And some phrasal verbs always have to be separated, but this is comparatively rare. Like in the sentence, Oscar will take Sven up on the offer, which means will accept his offer, take up. Well, and so that was the theoretical information. And if we look at this slide, we can see that there are some sentences where we need to replace one of the verbs with a phrasal verb. And you may be able to separate the particle from the verb where it is appropriate. I mean that if we have a look at the first sentence here, let us listen to Manish. Will you read the first sentence?
Yes, ma'am. The doctor identified a few benefits and a few side effects. Pointed out.
Yes.
Is it pointed out?
Yes, this is.
Doctor pointed out a few benefits and a few side effects.
Okay, so good. Now, please, I'll give you a couple of minutes. Just you write the sentences using the right phrasal verb, which has one of the phrasal verbs which I given in the box. Okay. Let us check now. So, Pradeep, are you here?
Yes, ma'am.
So please, the second sentence
You
is
can keep a pillbox with the days of the week on it and remove the tablets each day. Take out, ma'am.
yes. Instead of remove, you should use. Sorry, what?
Take out.
Take
Take
out.
out.
Okay. Yes. Does everyone agree with this?
Yes, ma'am.
Yes,
Okay.
Yes, ma'am.
So, Rohita, please. The next number 3.
Yes, ma'am. Completing a prescription requires great care. Write out.
Yes, writing out the prescription requires great care. Okay. So, Bhuvanesh, please. Bhuvanesh, are you here? No reply. He's absent. So, Sohita,
Yes, ma'am. Don't forget to read the instructions on the label. Don't forget to look at the instructions on the label.
great.
at.
So, yes. Afnan,
Yes, ma'am. Try to adopt a routine for taking medications if you can. Try to get into a thing, ma'am.
try to what? Get into.
Yes, ma'am.
Okay. So the next is for Hadija.
Yes, ma'am. Contact the hospital immediately if anything happens. Get in touch with the hospital immediately if anything changes.
Yes, okay. And the last is for Mayuka, please.
Yes, ma'am. It works by reducing the workload of the heart. It works by cutting down the workload of the heart.
Reducing, cutting down. Okay, so we need just to try to guess the meaning of phrasal verbs, judging by the components it consists of, the verb and the preposition, the particle. Okay, and now we go back to speaking about concordance, which was the case when last class we read the article about nurse practitioner, and she started speaking about concordance. And here is some just statistics about the use of medicine in the United Kingdom. Statistics for concordance in general practice in the United Kingdom. So let us look at these statistics, read what is given here. And here, Bhargavi, please read it.
Yes, ma'am. Statistics for concordance in general practice in the UK. Sufficient concordance to attain the therapeutic objectives occurs about 50% of the time. 1:6 patients take medicines exactly as directed. 1:3 take medications as directed 80 to 90% of the time. 1:3 take medications 40 to 80% of the time. The remaining 16 to 17% take medications directed less than 40% of the time. 20% of the prescriptions are never cashed.
Yes, so this is just very interesting information that people, even some patients do not even buy the medication which were prescribed by the doctor. So, and concordance is about only 50%. And this is the information about the United Kingdom, Great Britain. And what about your country, in India? I don't think that you've looked at the statistics, the exact statistics for your country. But what do you think about the people in your country? Do they just take all the medicines which were prescribed to them? Or is the concordance similar to what is the situation in the United Kingdom? What do you think of your country? Who can answer this question?
I think most of the people take the medicines according to the prescription. Only few people, less than 10%, I guess.
10%.
Yeah,
Mhm.
I feel that because for the major diseases or major uh, treatments, they'll obviously take medicines. For minor like fever, they take rarely.
Mhm. So you say that it depends on the illness, how serious the illness is, right?
Yeah.
Okay. What are the other factors that also influence the percentage of concordance? What do you think? So one of the factors is how serious, if it is a minor or major disease. What are the other factors that influence this?
I think seeing the other patients doing the same thing as directed by the doctor, going to the pharmacy and taking the exact same medicine. So they also think that we should do the same, seeing the other persons, and they don't think too much before taking the medicines. Just do whatever the doctor tell them and go to the pharmacy and take the medicine.
Yes, this is the way to follow. Yes, this is, you're right. Okay, okay. Now we are going to read about these reasons, about the concordance. So the article, this is the first part of the article, and let us just listen to Vidya. Will you read it?
Yes, ma'am. Non-compliance in medicine taking is a long-standing problem in all therapeutic areas, including the treatment of cancer. There is strong evidence that despite the introduction of new medicines, which have fewer side effects and are more convenient to use, many people still do not take them as prescribed. Even when not doing so, can have life-threatening consequences.
Mhm. Here is the, so they mention a very serious disease like, what disease?
Cancer.
Cancer. Yes, and they also, there is information about new medicines. Why are they new? What is new in these medicines? They are new because what are the characteristics here of new medicines compared to the old ones?
Maybe they have fewer
Compare
side effects.
Few side effects.
Any
Few
side
side effects
More
compared to the old
convenient
ones.
to use.
Exactly, yes. Mhm. Okay, so this is the first part of the article. And then let us listen to Lahari. So read it, please.
Yes, ma'am. Medicines prescribed for preventive purposes are especially likely not to be taken as prescribed. This may be because people do not feel immediately threatened, and in the case of symptomless conditions such as raised cholesterol levels and hypertension, feel no obvious benefit at the time when medicines are taken.
Mhm. So this is the information about the medicines which people do not just take. They are what kind of medicines? For prevention of diseases, right? So preventive, for preventive purposes. Mhm. Okay, and the next piece of information is for Manish. Read it, please.
Yes, ma'am. Factors associated with the poor compliance include complex regimens involving multiple doses and several medicines, unwanted side effects, concerns about the value or appropriateness of taking medicines in particular contexts, uh, den- uh, denial of illness, especially among younger people, confusion or physical difficulties associated with medicine taking, which most frequently affect older people.
Mhm. So two age groups are mentioned in this part. What are they?
Younger and older people.
Yes, and why do younger people not take medicines?
Because they have a bit more immunity compared to the older ones.
They have, sorry, what? Will you repeat, please?
Immunity, more immunity power.
So this is your opinion, but what does the article say about this? They deny the illness, yes? They
Deny of-
say,
yes,
I do not
deny.
believe this, I'm healthy. And older people, why don't they take medicines?
Confusion or physical difficulties.
Yes, they have some difficulties with taking them. Okay, and there is also the reason when people are confused how much, how many tablets, how much of medicine to take, and how many times a day. Okay, and also side effects. And if we go on with this part, let us listen to Pradeep.
Yes, ma'am. Effective ways of improving complaints rates involve the complementary use of educative, practical, and emotionally and behaviorally supportive interventions rather than the provision of information alone. There is evidence that regardless of the specific knowledge imparted, self-management programs which help to raise people's sense of self-efficiency and confidence promote better medicine taking.
Mm-hmm. So we should give the patients information, but we should also do what? What should we do to improve concordance?
Specific knowledge, ma'am.
Yes, to give them specific knowledge, to educate patients, and to support emotionally, right? And there is information about some self-management programs, so that helps help the patients to deal with the medications themselves. Well,
Yes.
To increase their self-confidence so that they can take the
yes,
medicines.
exactly, yes. Mhm. Okay. Well, now let us listen to Rohita. This part, please.
Yes, ma'am. Health professionals should respect patients' autonomy and accept that increasing compliance with prescribing instruction is not as important as meeting patients' individual needs and priorities. Patients need help to make informed choices about treatment. For example, there is a need to differentiate clearly between situations where varying the time or quantity of medicine doses may do little harm or even be beneficial, and situations in which there is a high probability of adverse clinical outcomes.
Mhm. So be informed is very good, but so we should also just take into account patients' individual needs, and they should make informed choice of the treatment. Mhm. Well, and the last piece of information is for Suhita.
Yes, ma'am. Improvements in self-management skills and compliance in medicine taking can generate significant benefits for individual and population as a whole. Combining medication reviews with other forms of timely and appropriate support for patients and carers represents an important route towards better and more cost-effective use of medicines.
Mhm. This is what should we do to improve concordance. So, well, yes, well, and yes, we have only 1 minute left. So break in 10 minutes. Now let's take a break. Okay.
Okay, ma'am.